Assalamualaikum Doktor.
Waalaikumsalam. Belum ada yang masuk
Belum Doktor, we just finished anatomy lecture.
Tak apa.
Maybe they are having question Q&A session.
Okay. Tak apa. Saya pun baru habis meeting. Tak apalah, I allow few minutes. Alright, okay, hi everyone, Assalamualaikum. I think I'm just going to start lah. I know you just had lecture juga kan? Anyway, before I start, firstly, sorry that I have to rearrange it now, pukul 3. due to unavoidable circumstances. But I have already forwarded my lecture course. Okay, so I have a lecture there. I have all the activity there that you can do, and what I'm planning to do today is just to go through important points in the lecture topics, adhering to the SLO, okay, the lecture objective. So whenever you go through the lectures, please bear in mind that lecture objective has to be met. Okay, anything that beyond lecture objective is just nice to know, and you're not going to be assessed in the exam. Right, okay. I will have questions. I'll prepare Kahoot for that. Okay, so I'm just going to open up the... I'm not going to play full video lah. I'm just going to fast forward whenever it's necessary. Then I'm just going to... macam mana, boy? I'm just going to explain about the... wait. Mana? Okay, is it this one? Is it present? Am I sharing screen?
Yes, Doctor, you are.
Okay, so this one dah terlepas lah pula kan. Okay, this lecture supposedly, so I hope everyone else is joining in lah. I know it's evening, just to get the concept secara live explanation lah kot, because if you have listened to it, hopefully you have gathered some idea about local anesthetics, and you have also listened to general anesthetics kan, from Dr. Anna. Local anesthetic was supposed to be done before general anesthetic because there's a reason for it. You have to differentiate between local anesthetics dengan general anesthetics lah. Okay, now that you have done general anesthetics, so now you should know that general anesthetics involve loss of consciousness. Okay, so that's only the difference between general and local. And besides that, there are also local is supposed to act locally, so general is supposed to cause general anesthesia, including loss of consciousness. Okay, so for this is I have given the side page, so I hope that there's no, tak ada masalah untuk open up the lecture. If you have, probably somebody has already approached me kan, open up the assessment, so everything else is you are able to do, so that's good, so no problem in terms of sharing the content. So in a way you can if you have anything to clarify, there are few students that already approached me and asked about the topics. Okay, so I already prepared Kahoot, so I'm going to ask questions lah. Okay, so as you know, so this is the for the part 1, all right? So macam mana? Okay. So basically, what I want to emphasize here is that okay, the important things in local anesthetic is that we have to classify according to the group. Okay, so local anesthetic you have one is amide and one is ester. So under amide you seperti drug-drug kelas yang lain, dia ada dia punya subtype dia ada dia punya example, right? So the example I always remind students to ingat at least 3 to 4 lah. Because, okay, for example, I put here lidocaine for amide and procaine for ester. But nanti dalam soalan, tak semestinya lidocaine akan ditanya kan. So, but I'm still asking about amide group. Alright, so when you do your readings, do identify other names as well. Okay, so that's that. And then, of course, the mechanism of action. Stated here only one. If you come across a different pharmacological punya lecture, we always put note on mechanism of action of this drug. For example, drug A, mechanism of action for drug B. But for local anesthetics, the mechanism of action is the same for both groups. Okay, the only difference is that the chemical structure, okay, and then the punya pharmacokinetics, okay, and about how the ADR come about. Okay, that is actually depending on their punya metabolism. Okay, so that is main pharmacological effect and then clinically relevant pharmacokinetics. Alright, so yeah, ini by now you are already in year 2, so you have gone through many modules. So you should be able to relate the significant pharmacokinetics with clinically relevant features of a patient. Okay, the most common is always about the liver. All right, so whenever is the liver problem, so there will be some impairment in metabolism, so the drug is going to be retained longer in the circulation, so the ADR is going to be far or significant. So, and then before starting any drugs, you should make sure that the liver is in a good shape. If it's not, then you have to adjust the dose. And if, let's say, for kidney, it's also part of metabolism organ, so you also have to make sure that is checked also. All right, so this is about pharmacokinetics. That is common. There are also other factors that might affect pharmacokinetics of a drug as well. All right, so clinical use for local anesthetics. So besides surgical procedure, okay, so any minor procedure in operation theatre, okay, that does not require for the patient to be in a sleeping, so-called sleeping lah, sebab dia punya consciousness is disturbed kan, kalau in general anesthesia. Okay, the specific adverse reaction, why is it specific? Sebab we have to identify for ester group, there are specific ADR dia, dengan amide group also ada specific ADR. But there are also the ADR that commonly occurred. Alright, commonly occur means that by now you should know the CNS can be affected, cardiovascular system also can be affected, okay, by LA punya effect. The factors that govern clinical effect is, okay, the factors, so because it is plural, so there are what are the factors that might affect the local effect of LA after we have given LA. So because of the LA properties, there are factors that might affect how the LA initiate dia punya action. Okay, so what are the factors that might contribute to the effect of the ADR? Okay, so this is the clinical effect, whether it is desirable ataupun undesirable. And discuss the two types of LA toxicity and their presentation. Okay, the two types of LA toxicity and their presentation. Okay, this one is pertaining to CNS and as well as the cardiovascular. Okay, let's see. Kalau I main ni, kalau I tekan play jadi lama tu kan. Cuba nak pergi dia ni Kata nak play benda lah ni. Oh, okay. Why? Okay. Okay, bear in mind that when you come across this slide, I put cocaine here sebab this is like the beginning of LA. Okay, they found LA accidentally in LA effect in cocoa leaf ni, and then subsequently cocaine was introduced. But however, cocaine now is not used. Okay, is not used in clinical practice for LA. Okay, is used for something else lah, but of course it's not used for clinical practice. We do have students tulis cocaine. We cannot accept the answers sebab it is not used in clinical practice, so students should not apply this whenever we ask like questions pertaining to clinical effect. Or let's say the example of LA that can be used clinically. All right, so this is what I want to highlight lah, because over the years that after the lectures and exam questions is ada students yang mention cocaine, so I figure must be because I mentioned it in my lecture, so I strengthen it further that is not going to be written down lah, just for your knowledge sake. Okay, so yang ini I feel is already being explained by Dr. Anna. If it's not, then this is the difference between analgesia dengan anesthesia kan. Okay, hopefully no confusion. Okay, between analgesia dengan anesthesia. Of course, you have come across analgesia when Dr. Alimah gave a lecture on opioids. Okay, because opioids is a form of analgesic. Okay, so the analgesia is only pain, but loss of other sensations and consciousness is still intact. Okay, all right. Okay, so these are the example of clinical settings that is used that use LA. Okay, I'm sure all of you probably dah pernah kena kot kan. Kalau pernah cabut gigi ke, pernah buat any dental procedure, braces ke, or if you pernah accident, minor accident ke, even if you have do any surgical procedure yang very minor. Okay, so LA is usually given lah. Okay, alright. Even dekat sini I letak apa nama delivery for pregnancy but because that one can be considered to use either epidural ataupun spinal. Okay, I put at the end of my lecture a type of LA. Okay, that is also for knowledge sake. We are not going to test any details regarding on how to perform like LA blocks, okay, nerve block, for example. Okay, what are the nerve that affected? So these are just for your knowledge sake lah. You will be actually exposed to this when you do anaesthetics posting. Okay, when you do specialized posting masa year 4. Alright, so this is just want to introduce to you the usage of LA in clinical practice. Okay, the important is that this one I've already explained at the beginning of the lecture. All right, so it's actually drugs that block impulses generation and nerve conduction. Before you understand about how LA works, you really have to understand how the impulse generation and action potential be carried along the nerve fibers. Okay, so like pain sensation is actually being carried from the nociceptors and then from the receptors, pain receptors when you receive pain stimulus. So the pain is the action potential is being carried in the nerve fibers up to your central nervous system to be translated. Okay, so that actually require all the sodium influx and to produce action potential. Because of that physiologically mechanism on how impulses is being generated, that is how LA works. Okay, so we want to block the impulse transmission and action potential generation from the pain receptor to the central nervous system. Okay, that's why it is local and that's why it's peripheral. We do not want it to get to central area. So this is the use of LA lah. Okay, so when we block that transmission, there will be no pain sensation. Okay, all right. So this is the aim for the usage of LA. Okay, so and of course I mentioned it many times. There will be no local. There will be no loss of consciousness. Okay, for this purpose, I mean, for this slide is, well, is according to if you refer Goodman and Gilman's, Orang and Dale's, this effect of LA on nerve fibers is only to explain to you how the LA is going to take an effect on different type of nerve fibers. Okay, different type of nerve fibers going to carry a different type of sensation. Kan, they are the pain sensation, they are the touch, pressure, temperature. And those sensations are carried by whether it's myelinated ataupun unmyelinated. So whether the fiber is thick or thin, depending on diameter. Okay, so for LA effect of LA, it is going to block pain sensation at the first. All right, so the pain sensation is going to block first. But for this is, well, when we give LA, we don't really want to time when the LA is going to take the effect. Okay, so that's why this slide is just going to inform you about how the LA is affecting the nerve fibers depending on the nerve fiber structures. Tapi dia tak akan ada any clinical implication lah. Sebab we know that the LA akan menyebabkan loss of pain sensation and the rest of other sensation but not consciousness. Okay, obviously bila kita kasih for example spinal block spinal block kita block dekat spinal cord dia, for example level 5 kot. Okay, so level 5 akan control the whole from the hip down kan. So patient tu will not be able to experience any pain, any touch sensation, any temperature sensation, and they will not be able to walk also. Sebab everything that carries all the nerve fiber that carries all this sensation has been affected. Okay, so it's not really necessary for you to identify which goes away first. Okay, but you all the time is always the pain will be affected, and then the last part is your motor. Okay, so this is also the how the LA is affecting the nerve fiber depending on the nerve fibers that carries different type of sensation. Okay, so okay, coming down to the LA structure, you have the amide and you also have the esters. Okay, the different type of the ring portion, the amine portion. All right, so this is clinical implication on this is actually only on the metabolism part. Okay, whereas the esters and amide has a different way of metabolize. Okay, and this will affect their adverse drug reactions and their systemic effect. Okay, alright. So yes, yang ini you kena list down a bit more. So the amide type here, I put here long acting is bupivacaine and intermediate acting is lidocaine. Okay, this is very commonly used, and ester type is tetracaine and short acting is procaine. Perhaps if you go on revise again you punya cardiovascular, you probably have come across lidocaine kan masa dalam antiarrhythmic. Okay, so this is because that the sodium channels that control the heart rhythm is also being affected, and sama juga dengan you punya epilepsy. There's also sodium channels that ada mechanism of action in anti-epileptic that affect sodium channels. So that's why local anesthetics ada kaitan dengan epilepsy as well as arrhythmia. Okay, alright. So how do I? Macam mana nak move on from here? Okay. Okay, before this one, before I want to stress upon mechanism of action of how LA works, and before I move on here, any questions so far?
So far, no, doctor.
Okay, I hope that actually the recorded lecture tu dah pretty much explainable. So tak adalah banyak sangat nak kena explain now, hopefully. So anyway, so okay, this is basically how you want to memorize lah. You should have done this to all the drugs dalam setiap module. Okay, find a way on how to memorize the drugs because there are a lot. So anyway, okay, mechanism of action. So what come here? Can I go to that? Okay, all right. So why I put the weak bases and remain partially ionized at physiological pH? The properties of LA affect dia punya mechanism of action. Although if you realize that this is actually boleh letak bawah properties kan ataupun dia punya criteria. But however, dia punya properties of LA affect on other effect on their mechanism of action. Hence, that's why we have to stress upon that LA is a weak base. Okay, so because of the weak base, you have to think about when LA is given, at an acidic environment, what will happen to their structure? Okay, how will that change the ionization of La? All right, so they must be and then remain partially ionized at physiological pH. Fine. So if it become acidic, then will it be ionized or non-ionized? Okay, so the physiological pH of the environment will affect La structure. Okay, when it affect La structure, dia akan affect how La works when we give La to the patient. So this will actually has an effect on how La is going to penetrate the nerve sheath membrane, because reason they have to penetrate is they have to block the sodium receptor site too at the inner side. Right, it's not at the outside. They can cross dulu the nerve sheath membrane to get to the inner side, and then baru they boleh block the sodium the sodium gated channel. So sodium tak boleh masuk. Okay, so unionized, so it has to be an ionized form. Okay, so in an ionized form, baru dia boleh masuk, and dalam nerve fiber itself, it will get ionized because of the changes in pH, and then it will interact with the receptor. So obviously in an ionized form, dia tak akan interact with the receptor, alright? So these two form, one is for penetration and one is for interaction with the receptor. Okay, this is what I've explained before lah about, for example, pain stimulus. Okay, for if there is a pain generating pain, then ada pain receptor, and then the action potential and nerve conduction akan travel here, right? So these akan ada sodium channel, alright. The sodium akan goes in and causing more development of the action potential, and that is how the nerve conduction happen. Okay, so this is actually physiology of nerve conduction fibers. Okay, so everywhere, it's not just for LA punya mechanism of action, but that is how LA can also be used as an antiarrhythmic because of the sodium gated channels as well, and also for anti-epileptics. Okay, it's because of the features, the sodium. Kenapa dia ni? Okay, panjang sikit. Alright, so hence I have asked here, okay, why sodium channel blocking is exploited in the treatment of cardiac and CNS disease. So, well, cardiac here I mentioned before, the antiarrhythmic, and CNS is epilepsy, because you also have sodium gated kan dekat dalam epilepsy. Okay, yang ini ialah for the use dependent, because the sodium channel can be features as three structure. Okay, satu ialah resting, open and inactivated. Okay, some books say resting is closed and open gated is open and inactivated. So there are explanation on use dependent. Okay, use dependent means that whenever the action potential is traveling, then the gated channel akan open. Okay, so hence that is when the local anesthetics will enter through the sodium gated channel and bind from the inside. Okay, so hence this is the LA lah. Bila dia dah masuk dalam nerve sheath membrane, so they akan block this sodium channel, hence there will be no sodium and there will be no depolarization occur. Okay, so this also has not so much implication on clinical features, sebab when you give LA, we know that we give LA right before procedures. For example, kalau kita nak cabut gigi, kita kena bagi LA dulu kan, supaya kita rasa numb, so there will be no pain sensation. So at that time actually there will be no action potential yet, sebab kita tak ada develop any pain yet. Okay, so that's why dia punya LA tu belum ada effect lagi. But however, if the patient is already, for example, in a trauma, so there will be a cut, for example, in the skin, so the pain sensation is already started. Okay, when pain sensation is already started, then the sodium gated channel will be open close kan, sebab dia punya action potential akan moving. So when the action potential is moving to one node to another, they will be close and open, close and open. So this rapid transition from resting and open will actually affect how LA enters the nerve sheath membrane. Okay, that also depend on the pH location of the surrounding lah where you give the LA. Okay. Alright, so the refractory period ni maksudnya ialah bila the sodium channel open and close lah in between the action potential generation. Alright, okay, so the effect of pH is actually the one that has an effect on the mechanism of action. pH will definitely will affect dia punya mechanism because it is weak base. Okay, when it is weak base, it has to be in an ionized form. As an ionized form, it is weak base and it is ionized. Then only it can penetrate the sheath membrane. In the inside, it becomes ionized, then it will interact with the receptors. However, when it becomes ionized outside due to the changes in pH, so it will not be able to enter the nerve fibers. So kalau dia tak boleh enter the nerve fibers, it will not be able to bind logically lah kan. Dia tak boleh bind dekat through the inside of the nerve sheath. Alright, so there will be no effect of LA. Okay, so that's why dia punya activity akan reduce in the acidic pH sebab they become ionized. Right, so the ionized is not membrane permeant, so dia tak boleh nak masuk dalam nerve sheath. How do you want to apply this clinically is that you have to identify what kind of situation gives you an acidic environment. Okay, for example, a dirty wound kan. Kalau dirty wound kan ada banyak some debris or dead tissues that will create acidic environment dekat sekitar kawasan luka tu kan. So because of this knowledge, you will not directly give LA dekat kawasan yang inflamed. You see, so the inflammation will cause acidic environment. So you move away from the acidic environment, then only you apply local anesthetics to enhance the punya effect. So otherwise, we really have to make sure that the punya surrounding structure tu is very clean. So maksudnya kalau patient tu okay, another contoh ialah bisul kan. Kalau bisul yang besar kan, ada all the nanah, all the pus and everything, all the debris, all the yellowish color and all the blood and everything else. So if you want to do an incision and to remove the pus, so you really have to move away from the what we call kebangkel. Okay, kebangkel is bisul lah. Okay, you move away, so only the LA will have the effect. Okay, somehow if you don't have this knowledge ataupun you lupa ke kan, bila you dah practice later on, you tend to give at the injured side. So logically, you probably think that the injured side is the one that needed most LA. Okay, but obviously that will not happen sebab you know that LA is a weak base and it becomes ionized when it interacts in acidic environment. So acidic environment is all this inflammatory side lah. Okay, so hopefully this will not be happening later on when you are practicing. Alright, so okay, this is what I've explained. Can you explain the reason why LA onset is faster in a clean wound? Okay, so this is the explanation on this slide lah. Okay, the properties of each of the LA lah. So the rate of onset, okay, yang ini memang all the drug group will have kan, all the different subtype, all the even though it's the same group, tapi dia different subtypes, dia akan ada dia punya own properties, right? And so that will actually affect dia punya onset of action, duration of action. Hence, that's why one is long acting, one is short acting. Okay, so this is pretty much on how if let's say it is more alkaline, so the onset is much more longer. Alright, so the lidocaine, the onset is fast. So that's why lidocaine is always used kalau kita ada short procedure. because when we give lidocaine, dia akan menyebabkan loss of pain sensation immediately, especially before we start any procedure. So we give lidocaine first, and then we try to cause any pain after a while. Then the patient will not experience any sebab dia punya short actingness of the drug. Okay, so the duration of action. Okay, so if you look at between ester and amide kan, macam lidocaine, the duration of action is medium. Okay, so yeah, ini basically is pretty straightforward lah, come from your textbook kan. Kalau you ada dalam rank and deal, there's a nice table that summarize list of LA with the duration of action dengan onset, which is good because you can directly see it. What is the onset of action, what is the duration, tissue penetration, and also the mean ADR. Okay, so the hydrophobicity is one of the factors that affect duration of action. Okay, because the hydrophobic LA, okay, yang ini you have to identify which one is hydrophobic LA and which one is hydrophilic LA. So the hydrophobic LA will have a longer time binding to the receptor, hence the duration of action is long lah. So this is true for tetracaine. Okay, so all this longer duration of action usually is used in a minor procedure tapi dalam OT. So maknanya for example kalau dia nak buat knee amputation. Alright, knee amputation is dia kan belah bawah kan, lower limb, so you don't actually need to put the patient under general anesthesia, especially if the patient condition is not permits. So you probably opt for local anesthesia. So you probably want the longer duration of action. So you can opt for tetracaine. So you don't give tetracaine for a short procedure such as tooth extraction ke, sebab nanti dia punya effect dia lama sangat kan, and then dia punya ADR pun probably greater than the one that has shorter duration of action. Okay, another point that affect duration of action is protein binding and the duration of local contact. Okay, in the duration of action, there's one point that is very important for you to understand that ada tak dekat sini? Okay, not this one. Okay, protein binding, this one is all statement. Okay, is it this one? Oops, sorry. Okay, why is it not coming out? So anyway, for duration of action of local contact, absorption, distribution, and metabolism, these are also factors that affect duration of action. Okay, so if it has a good absorption, obviously it is the duration of action will be longer lah. Okay, but distribution also, good distribution at the local area will have a good long duration of action. Okay, however, duration of action will be shortened if, let's say, the distribution to the systemic circulation happen. Alright, so LA ni you are supposed to not give inside the vessel. Okay, so LA is given intramuscularly lah, dalam muscle, sebab dalam sekitar kawasan muscle tu, but you don't directly give inside the veins. Logically, because you will get the LA inside the systemic circulation, which you want to avoid. Why? Is because that you want to avoid systemic ADR, such as CNS dengan cardiovascular, which actually can cause cardiorespiratory depression or CNS depression lah. Okay, so you really want to limit it at the local area. So there's one agent that will cause vasoconstriction. So this agent usually give with LA. Okay, so you give vasoconstrictor with LA. So you want to limit the distribution locally, right? So you don't want to extend the distribution to systemic and allow systemic circulation to be interfere with LA. Right, so that vasoconstrictor, I'm not sure, maybe it's in another slide. Okay, okay, so coming down to pharmacokinetics. Okay, so generally all LA has good absorption. So there is LA that is prepared for local application. So you don't actually need to give injection of it. Okay, kan kalau cabut gigi kan you kena inject dekat dalam gum kan. So that is another way. That one is actually you want to reach the nerve. Okay, the nerve punya yang supplying the apa nama root kan, teeth root tu. Okay, kalau dekat local application dekat skin, probably this is applicable for children. So kalau children kan dia takut dengan jarum, so you want to do some procedure, so you boleh apply some local application on the skin. If you have heard of EMLA application, that is actually lidocaine. Alright, so but bear in mind it's probably not that the effect of loss of pain sensation is not that great as to compare with intradermal ataupun intramuscular lah. Okay, so the systemic absorption of LA, so out of the tissues. So if let's say you have a cut here, you want to inject, you want to do some procedure stitching, so you want it to be inside the tissues. Okay, so this is what I have described before. So if let's say the LA moved outside the tissues that you want to work on, it means that you will not have any effect on the location. So that is actually the termination of the local anesthesia lah. Okay, so hence we want the local anesthesia to retain dekat dia punya area of action. I mean, so if you want it to be on your knee, then knee saja. So you really have to avoid local anesthesia to be distributed systematically. Okay, alright, so okay, so I'm sure this is not part of LA. This one is, I don't think it's inside my video punya recording. So this one is just want to, because it's evening, and then you have already seen my recorded video. I hope all of you have and listened to my explanation. So let's just have some SpongeBob punya spot the difference lah, and to see what is the difference between these two pictures. Okay, I'm also looking. Yeah, I've not seen this actually. I pun tak tahu kat mana.
It's very detailed,
okay.
doctor.
I know.
Alamak.
Table stand.
Saya suruh cari satu. So kalau banyak, okay, I dah nampak dah lah. Dua ke? I thought satu. Okay.
Dua.
Okay, so alright, thank you SpongeBob. Bye. Alright, so let's move on to, obviously dia akan ada banyak. Okay, yang ini I hope you highlighted apa benda yang I cakap yang significant. Kalau significant tu is highly likely that it's going to be asked in the exam lah. Pretty much if like let's say PBQ ke SAQ kan, because if significant then you really have to remember and know until forever. So like for example, this metabolism part of pharmacokinetic kan. So the difference between asteroid structure and how it affects metabolism, and that's also very significant. Alright, so okay, this one tadi I dah masuk ni. Alright, so how it affects, okay, this one is systemic. I've touched on this already about the vasoconstrictor. Okay, systemic absorption, you really have to avoid LA to get into the systemic circulation and to make sure the reduction of plasma concentration lah. You don't want it to get into the plasma. So if you, let's say you inject into a high vascularized punya area, so you really cannot avoid the punya vessel. So you might as well inject the vessels and put LA inside and cause systemic toxicity. So you have to be away from a highly vascularized punya tissues. Okay, so that you will avoid distribute the LA dalam plasma. Okay, obviously dose also akan affect lah systemic absorption. The higher the dosage, then the more highly likely you will disseminate LA to dekat systematically. Okay, yeah, ini I've mentioned it, vasoconstrictor. There are also, I mentioned it, vasoconstrictor, and if let's say there will be questions to be asked, so I'm going to mention vasoconstrictor. But however, if let's say after this you go clinical, they mention that LA is also combined with other drug groups such as steroid. So that is because that steroid also has the property of vasoconstrict. Okay, because but this is not mentioned here, so don't worry. I'm not going to ask any other than vasoconstrictors such as adrenaline lah. Okay, the one that how adrenaline has an effect of on LA action. Okay, so apart from adrenaline, yang ini I advise tak payahlah ingat banyak-banyak pasal vasoconstrictor at this stage. Later on, I do not know lah. Later on, bila you learn more on how they administer LA, because clinical application, they are more following the up-to-date. Yang itu you memang kena refer to guideline on how, for example, our anaesthetics prepare patient for local anesthesia. Okay, what kind of local anesthesia is always used for what kind of procedure, yang itu very clinical. Tapi whatever you are learning here is pretty much a concept and basic knowledge on LA lah. So you have to know the mechanism and how to prolong the duration of action and to get to systemic circulation to avoid ADR. Alright, okay, so okay, this one I mentioned. Oops. Ini ada keluar ke? Yang ini supposed to be, oh yang ini I supposed to check again lah. Never mind, I check again the Menti. Okay, so distribution, like I mentioned, if it gets inside the systemic, it is going to get to all parts of the body, including CNS. So that's why CNS akan ada effect on LA and cardiovascular toxicity. Okay, so these are the two most important organs that is affected by LA lah. Okay, and you should know that when patients suddenly become agitated, there are seizures ataupun any loss of consciousness ke ataupun headache ke, so they already experience the CNS effect. So you know that this LA has already gets inside the systemic and already gone to the CNS. Beside that, probably dia ada hypotension ke ataupun dia suddenly develop chest pain ke, arrhythmia ke, so you already know that this LA is not only localized. Okay, bear in mind that if you remember one of our the hot case after dental procedure, I think it was menantu Zahid kot yang meninggal sebab dental procedure. So that is actually because of LA effect. Okay, he was given LA by a doctor. Do not know how much he was given to do some dental procedure, and then he succumbed kan, he passed away because of LA. Okay, most of the time kalau orang tu pergi dental procedure and something bad happen, it's because of LA. Okay, so because usually dental ni dia use LA quite a lot. Okay, they don't play any other drugs. They only play with LA saja. Unless they do general operating, so they will also need to know about general anesthesia lah. Okay, this is what you have to highlight also. Okay, from between ester and amide. Right, so because ester is metabolized by plasma esterases. So our esterases are freely available inside the plasma. So once ester gets inside the systemic circulation, dia akan jadi dia akan dimetabolizkan. Okay, so and then amide is by our liver. Alright, so that's why ester punya type ni, dia punya metabolism is very rapid sebab bila dia masuk systemic circulation, dia akan menyebabkan rapid degradation, and it will be people who has some defect in the enzyme will have some problem in metabolize ester. Okay, obviously this one is very hard to find unless you do some genetic study lah. Okay, so this one is usually people dah kena dulu baru tahu yang dia ada some sort of genetic defect to ester. or to esterases that metabolize ester. Whereas kalau amide for the liver, so anyhow the liver damage ke, liver failure, hepatitis ke, anything that affect the liver condition akan menyebabkan amide ni take impair dia punya metabolism lah. Alright, but however because dia dekat liver, so dia boleh freely when it gets into systemic circulation. Okay, in this sense you probably wondering kalau macam mana pula, why we're talking about the metabolism when we do not want the LA to get inside the systemic circulation. Okay, when LA is given, okay, after dia punya effect has wear off, it will get inside the systemic circulation. Okay, it will not just stay at the tissues. Alright, but however we depend on the dose. That's why the dose will give us estimation or not to create ataupun to cause any ADR. Okay, so we follow the safety of the dosing, and after the local effect has wear off, it will get into systemic circulation, and in the systemic circulation dia akan demetabolized by cholinesterases if it's ester, and go to the liver to be metabolized by the enzyme for amide. Okay, so probably you are wondering if it doesn't get inside the systemic circulation kan nanti dia stay saja dekat tissue kan. Okay, it doesn't make sense pula. Okay, it will goes but it will get metabolized lah. Okay, so that's why you cannot go overdose. Alright, so depends on blood level. So this is what I'm talking about. You cannot go overdose. It is depending on the safety dosing of the LA. This is based on calculation lah. Usually the one that giving the LA should know how much is the safe dose. Okay, hypersensitivity is more towards, okay, ini I think the tiga ni I akan ada explanation dekat next slide kan. Alright, these are the three main ADR. Okay, so hypersensitivity, nanti I kasih kahut Hypersensitivity is more towards the ester because of PABA. Alright, so you should know this, that bila dia cholinesterase reacted dekat ester, LA of the ester, dia akan produce PABA punya what do you call that? Dia punya precursor tu lah. Okay, so that's why when patient is taking sulfonamides, so dia akan interact with LA, ester type. Okay, because of this PABA. Okay, yang itu I probably going to ask you to read further on how when you give sulfonamides is actually antibiotics. Okay, so and then it reacted with ester type of LA. Okay, due to that PABA. Okay, PABA also will create more hypersensitive reaction, but amide does not, because amide does not produce any PABA punya precursor. Okay, so well, if you have seen, if let's say patient has had an injection of LA, probably they ada some rashes at the local injection site lah. Ataupun kalau ada local application, tempat yang disapu tu probably ada some merah-merah, so that is actually the ester type of LA. Okay, the most serious is anaphylaxis, but it's very rare. Okay, right, coming down to CNS. Okay, these CNS, okay, these are the signs of ADR. Okay, so it depends on the plasma concentration of the LA lah. Okay, so if let's say low plasma concentration, dia akan menyebabkan depressant effect. Depressant ni cardiodepressant. Okay, patient will have some effect on the cardiorespiratory system, so dia akan cardiodepressant, respiratory depressant, CNS depressant. Ni bukan depressive mood tau doesn't have anything to do with depressive punya moods lah. Okay, kalau stimulation, so dia akan menyebabkan restless, okay, tremors, and patient boleh ada epilepsy, convulsion. Okay, respiratory depression, further increasing the dose. Okay, why people increase the dose? Okay, logically, let's say dia nak buat procedure, so dia kasihlah satu dose. Lepas tu dia nak buat procedure, patient complain of pain. So the doctor will logically akan give more lah, okay, hoping that it will block more and block more of the pain sensation and takkan ada pain during the procedure. However, the doctor has to be aware that the safety level, okay, kalau you keep on increase the dose just to get the pain sensation effect, it might cause a higher plasma concentration and cause CNS ADR. Alright, so that is the danger of LA lah. So that is one, hypersensitivity, second is CNS, and the third is cardiovascular. All LA akan ada effect on the arteriolar smooth muscle, so dia akan menyebabkan dilation. Okay, so this akan menyebabkan hypotension to the patient when they have given LA. Usually if it's given inside the hospital, dia akan monitor you punya blood pressure lah. Okay, this also according to the plasma concentration, the higher it is, dia akan menyebabkan more hypotensive lah. Kalau the higher the concentration, dia akan tend to develop hypotension. Sebab if let's say you give at the safe dose, less likely to develop hypotension lah. Okay, so this is actually all the effect depend on the plasma concentration of LA, right? So if the effect has wear off, it gets inside the systemic and then it gets metabolized, so you will not get any plasma concentration pun kan. So the effect of ADR is less likely. Okay, so and this is also one of the factor that may reduce the chance to develop systemic ADR lah. Sebab you actually restrict the concentration of LA that gets inside the systemic. Alright, so they maintain locally first. Okay, so when it maintains locally, so the LA will produce the effect. Okay, when it produces the effect, we tend not to give more LA so that it will create more effect. So kalau we do not give vasoconstrictor, we'll give a dose of LA, so it has no effect. So we tend to give more LA. Alright, so it tends to get inside the systemic circulation due to the vasodilation effect. Alright, okay, so that's why vasoconstrictor is another agent that is combined with LA to maintain duration of action and to minimize systemic ADR. Okay, so this is arrhythmia. Arrhythmia is also part of the what do you call it? CVS punya adverse drug reaction. What is the time? Cepatnya dah pukul 4 dah. I nak buat ni Kahoot. Okay, anyway, boleh ke I move on to Kahoot saja?
Boleh, doktor.
Boleh, I move on to Kahoot je lah. Actually, the rest of it is it's towards the end ni, it's just like macam application kan. Application ni go back and see the lecture objective. So usually dia tak adalah asking about how to give it a spinal blocker and so on and so forth. Just want to introduce to you about the LA punya ni lah. Sebab GA dia senang je. GA you tidurkan orang, you kasih je gas tu kan. You kasih gas, lepas tu you kasih maintenance dekat intravenous. So that is how you give GA lah. Tapi kalau LA, you kena LA ni dia spesifik sikit sebab dia ada dia punya type of procedure. Okay, so ini ialah sama ada spinal ataupun kenapa ada sama ada spinal ataupun ni lah epidural. What do I do? Okay. Oh, ada lagi I pun tak. Okay, you bagi I clue bila nak start.
Rasanya tunggu 2 minit lagi, doktor.
Okay, alright. 2 minutes. Dah ke? Dah 2 minit ke?
1 minit lagi, doktor.
Ya, okay, fine.
Nampaknya tak ada orang masuk, masuk lagi, doktor. Kita boleh start dulu.
Okay, I start Sekejap. Well, okay, so this one is more adrenaline. Yang ni you kena tengok lidocaine ester ke amide. Bicarbonate ni you kena tengok dia punya pH. Alright. Okay. Right. So the answer is protein metabolism is rapid. Yang ini is yang ini you have to check lah whether it's a mic ke ester, right? So maybe I have to check again the CNS toxicity. Well, CNS toxicity ni is actually depend on how much concentration dalam plasma. So it's pretty much but if it's SBAQ, then it's going to be this one lah. So this one is also can be true. Okay, so yang ini sodium ya. Sodium channel is not calcium. Okay, so the amide is lidocaine dengan ropivacaine. Sorry, it should be anesthesia ni. Analgesia is only pain sensation. Okay, yang ini should be anesthesia lah, huh? So and then loss of consciousness of course salah. Because anesthesia dengan analgesia is loss of pain sensation tapi intact all other sensation. Okay, so kalau anesthesia baru all this. Okay, yang ini pun sama lah macam tadi. Yang ini betul. Cuma yang ini is a bit tricky lah on the atas pagar sikit. Sebab kalau local anesthesia tak ada loss of consciousness. Kalau general je ada. So either this one change or this one change. Yep. So these two saja. Ini tak nampak lah ni. Apa ni? Oh, ni tak ada lah. Accessibility tak ada. Okay, baguslah at least semua orang agree. Okay, it's always the inside. Please remember that it has to enter the nerve sheath membrane because it blocks from the inside, not the outside. Okay, the punya location of the blocking of the sodium gated channel tu is from the inside nerve sheath. Okay, that is why pH is important. And ionized form and an ionized form. Okay. Amide is in the liver. Ester is in the plasma. Okay, dia takkan ada kena-mengena dengan bone marrow suppression lah ya. So all three is correct. Sebab dia tak ada effect on mitosis or cell cycle. Okay, so because dia akan act locally, dia tak akan masuk dalam systemic circulation. Dia tak ada efek apa-apa dekat pH ya, sebab vasoconstrictor tu dia tak ada pH punya significant. Yang ini ada orang jawab tak ada kan? Okay. I thought you nak jawab ni sebab you kena inject 2 kali. Okay, last question. It's not contraindicated, okay? It can be used in patients with epilepsy, although it might cause epilepsy convulsion, tapi it can be used. It's not absolute contraindication. Alright, okay, thank you. Who's the winner?
Yay, third place.
Oh, not bad. 2 aja salah. Okay, siapa-siapa yang okay, nombor 1 boleh claim prize from me. Alright, thank you and Assalamualaikum.
Waalaikumsalam. Thank you,
Thank you, Doctor.
Thank you, Doctor.
Thank you, Doctor.
Thank you, Doctor.
Thank you, Doctor.